First you gotta do the truffle shuffle.
Come on!
Do it.
Come on!
Do it!
Cut it out, Mo.
Childhood obesity is defined according to Wikipedia as a condition where excess body fat negatively affects a child's health or well-being. In recent years, this condition has become a growing concern in the United States, where 16 and 33% of children in the U.S. are obese. This rate of obesity has nearly tripled between the early 1980s and 2000. Childhood obesity can be blamed on the availability of unhealthy food choices near student populations and in communities where research has proven the correlation between fast food consumption and overweight children. A community-run initiative for the community to stop childhood obesity for Greensboro youth. This project will be in partnership with local schools, local community centers, local community shops, local government, and local media outlets and athletes, all working together to fight against childhood obesity. This program will be partly funded by local government backing and will stimulate the local economy by providing tax incentives to all schools, community centers, and community shops that comply to the regulations the local government puts forth.
The issue of childhood obesity is being brought to the forefront of American issues in recent years with the help of Miss Obama being the national leader and role model for healthy eating and exercise. Recently, she has stated, right now, nearly 1/3 of American children are overweight or obese. That is 1 in 3 children, she said. She goes on to say, if you continue on the current path,
if we continue on our current path,
in 10 years, nearly 50% of all Americans will be obese. Not just overweight, but obese.
If the issue of childhood obesity is not stopped, it will lead to an America full of overweight children with such life-threatening conditions as high blood pressure,
heart disease,
sleeping problems,
cancer,
diabetes,
and even death.
Death, if not prevented.
The school system will be more active in promoting emotional health options and all-around healthy living to its students by maximizing health education. Healthy food options will be placed in local places where students would go to buy snacks, providing that health option that was not easily accessible before, such as gas stations or small independently owned convenience stores. Local community centers will provide healthier food options in their facilities and more exercise equipment for youth use. Local media will provide not only news coverage,
as in advertisements, local public service announcements, and local commercials, but also provide a positive, healthy image to students in the area.
Local athletes will provide sound knowledge on physical health by visiting schools and community centers,
acting as healthy role models to the Greensboro youth.
Our solution is very environmentally sustainable. If customers in our targeted stores purchase fruits or vegetables as opposed to plastic packaged goods like candy bars or chips, there will be much less waste overall. The waste from vegetables or fruit is very easily biodegradable, so there are no environmental problems there. Our plan could also help local agriculture if we sell locally grown foods.
Did you know that Greensboro is the 3rd largest city in North Carolina?
And Greensboro has 30 elementary schools and 13 middle schools.
Oh yeah, and 15 high schools.
And 25 private schools.
We learned throughout the class that there are many ways groups can work together to come up with and support their ideas. With our group dynamic, we were more comfortable with using roundtable discussions. Everyone gave ideas on the subject of childhood obesity. The ones that we all agreed on, we used. We kept a record of all the ideas in case we needed to come back to them if one we chose did not work out. Everyone was responsible for certain aspects of the project and given a deadline to give their portion equally.
According to GetHealthyGuilford.org, 44% of elementary students, 29% of middle school students, 30% of high school students, and 60.1% of adults are obese.
North Carolina is ranked 17th in adult obesity in the nation. and 5th in childhood obesity.
Obesity-related illnesses such as cardiovascular disease, diabetes, stroke, and certain cancers cause healthcare costs to be at an all-time high.
And none of us wants this future for our kids, and none of us wants this future for our country.
Very few of us are victims, but kids are victims. They're very much dependent on what their parents tell them, what their teachers tell them, and what their parents feed them. And I've taken care of obese kids who weigh 240 pounds at age 12, and they tell me that on their way to the visit, mom stopped and bought them 2 Arby's roast beef sandwiches and a strawberry shake.
How do you answer the question, how? You have good intentions, you have good information, you're completely inspired. How are you going to turn your good intentions into a real change in your life and others? That's what I think this whole deal's about.